Hello, 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 NCLEX Crusaders. How are you? Saying hi to some of our friends here on our YouTube channel. How's the NCLEX preparation? Well, I'm here driving, trying this YouTube live on the cell phone driving. Not too safe, but I'll try to focus on the on the driving, not so much on the camera. But I wanted to come here and talk to you guys a little bit. I really like to interact with our followers because I think the NCLEX preparation is such a hassle. It can be such a hassle, and sometimes you feel lonely. Sometimes you feel like you're by yourself and that you don't have anybody to help you. And I hope you have found our channel, NCLEX Crusade International, as a means to know that you're not by yourself and that you have a friend here, Ray, your professor, that decided to create this YouTube channel to help the community and to help those nurses around the world that are trying to prepare and pass the NCLEX successfully. And I always want you to see me as an example because I was not born here. I was not born in the United States. I'm from Cuba. I'm Cuban. I learned English in the States, and if you see me, you see if Professor Ray did it at first without knowing the language and coming to a new country, learning everything new here in the United States, and I was able to pass the NCLEX successfully, and I have become a mentor for thousands of students around the world. Why can't you? So, what limitations do you think you have? Because most of the time, the limitations are here. Most of the time, the struggles are here. And each one of you have the potential inside of you to do what needs to be done to pass the test. And I know it is hard. I know that when you go and pass the NCLEX, everybody's happy and it's a big celebration. The problem is when you go take the NCLEX and you fail. And not only that, when you go and you fail once, you fail twice, you fail three times, what then? You know? Are the people that are around you, are they going to keep you supporting you? And sometimes the answer is yes, sometimes the answer is no. Sometimes the people that are supposed to support you give up. The question is, are you going to give up yourself? And I wish the answer for each one of you is no. Okay? So I wanted to come here live a few minutes and talk about some questions that I have seen in our Telegram groups. I will try to do this at least once a week just to have an informal communication, okay? I'm going to start doing our usual YouTube trainings. As a matter of fact, I want to do another 7-day training like the one we've been doing, for the past few months. And I have not been able to do it. I was for about a week and a half without a voice. I couldn't teach. I couldn't teach in the academy. But end of last week, I started getting a little bit better. I feel much better now. Thanks God. I will tell you that I was a little afraid that my voice was almost like gone, but I give thanks to the Lord that my voice came back and that I am strong again to continue teaching. I will tell you that I felt miserable not being able to teach last week. It was horrible. My wife was the one pretty much teaching the academy, and I was sitting behind the desk, and it did not feel good. I'll tell you that. I know you guys are writing, but I cannot look at it because I'm driving. I don't want to crash. So excuse me if I'm not looking at the questions that you've written, but I'll monitor it after. I'll read it after, and if there's any questions that you want me to answer in my next unprof not professional life, I will do my best to answer those questions. So let's begin. So one of the questions that I'm seeing over and over is the next NCLEX, the what is called the Next Generation NCLEX, is it going to be a more difficult test? And the other question is everything that I've studied so far, meaning preparing for the NCLEX now, is that going to help me for the next generation NCLEX? And the answer is yes, it will help you. Why? I'm going to answer the two questions. Why is everything you've done so far still going to be good for next generation NCLEX? The next generation NCLEX is still the NCLEX. It's still going to measure your ability to answer questions, your ability to analyze questions. So all the content you have learned so far, the critical thinking you have learned so far, the prioritization that you have learned so far is still going to be good. The reason why this is going to be good because the NCLEX is not going to change 100%. There's only going to be a few questions that they're going to add into the current NCLEX, and also they're going to make some slight changes on the percentage of the NCLEX categories. But at the end, it's still the same exam. So do not be overly concerned with the next generation NCLEX. Now, there will be a new type of questions called case studies, NCLEX style questions. And basically, what that's going to be, you're going to do a series of 6 questions back to back that is going to belong to a specific scenario. Let's say a patient arrived into the ER with abdominal pain, right lower quadrant abdominal pain, and then you're going to start doing questions regarding that scenario. They're going to give you doctor's notes, nursing notes, doctor's order, and based on that information, you have to answer the question. It's going to be 6 questions back to back in a case study. That will be a little bit different, and also the new style of questions. But everything you've done so far to re-rate, to confirm, is still going to be good. Don't think that everything you've done so far is going to be useless because it's not the case. Okay. And then the other question is this new test, is this new next generation NCLEX, is it going to be a more difficult of an exam? I don't think it's going to be more difficult. I have seen the what they're thinking, the new questions, what they're going to be like. I don't think they're harder. I think they it's going to require a little bit more of content. And also, I know that in our channel, a lot of our nurses, they're from other parts of the world that English is not their primary language. For for nurses that have lack of comprehension on reading the NCLEX questions, it may be a little bit more difficult because you have to read more. It's not like now you're gonna have like the one sentence question and then you select the correct answer. Some questions are going to be deeper. You have to read a little bit more. For those nurses, you may find it a little bit more difficult because of the comprehension part, because of the reading part. However, the offset to this, what I think is the best news, is that the evaluation method of the NCLEX, I think, is going to be more fair. It's not going to be on all the questions like it is now basically all or nothing. Next generation questions, NCLEX, is going to be more fair because they're going to give you points for questions answered correctly. They could take out a point for questions answered incorrectly. But the analysis is going to be more fair. It's not like now, for example, when you do a select or apply, if you answer three and the correct answer was four, it's wrong. It's completely wrong. Next generation NCLEX is not going to be like that, or at least not most of the questions. Okay. So I wanted to talk a little bit about that. Another question that I have seen in the Telegram, and I see some of you commenting on the chat about our membership. As many of you know, we created a membership several months ago to help nurses prepare for the NCLEX, and we decided to start the membership at a very low cost, which is $9.99 per month. And the reason I decided to do that, obviously, is not to become a millionaire, because I don't think you can become a millionaire like that. But it wasn't really my intention. I think I wanted to provide something to the community that you could see videos on demand and prepare and learn prioritization strategies that nobody else out there is teaching. And unfortunately, nowadays, everybody's charging like hundreds and thousands of dollars. So I wanted to create something a little bit more affordable for the nursing community out there, and that's when I decided to do the $9.99 membership. What happened was, when I first started it, the I guess there was an issue with the payment system that after a month the subscription would like cancel by itself, or maybe most of the nurses were canceling. But I think it was more of a payment issue because a lot of our nurses are from other countries, and there was an issue with PayPal and Stripe, that is the one that I used to collect the payments, and it was a big chaos. So what I decided to do, I kept the membership at the same price, the $9.99 per month. But what I did is I put a subscription limited to 3 months. That way I didn't have to run with the issue of the payment, at least not as often. So that's what I did. So now when you go into the website, you will see that you have basically two options. If you want to use the discount for the 9.99 access to the membership, just subscribe for 3 months, use it accordingly, because you have to see the videos, not like a movie, but really study them. And I see a lot of the nurses making the mistake of watching the videos like if they're watching a Netflix movie, and it's not like that. You have to study the videos. You have to play, rewind, go forward, go back, answer the questions yourself whenever you see a question. So I think in order to use the membership accordingly, you will need about 3 months, 3 months to really study the membership and uh, be a beneficial one. Any of you still have the option to see the videos here in our YouTube channel. It's completely free. And like I said on multiple occasions, I'm not holding an ace under my arm. The strategies that I have discussed in the 7 day trainings, they are my strategies. They are what I teach all the time, even inside the membership. But nurses are like, well, what's the purpose of having a membership if I'm gonna see the videos here on YouTube? Well, the thing is that what I have on the membership is they were live classes that I did for 2 3 hours, and I recorded those live classes and I put them into the membership, and then I continue growing the videos on the membership very often. Not as often as I would like, but very often. So having the membership will give you the opportunity to study and see more examples of what I teach here on YouTube. But it's up to you. You know, if you don't want to use the membership, just continue here on YouTube. There's no problem with that. Okay. So I wanted to give some insight on the new changes on the membership. So I saw a few comments. I'll come back and I'll read it. And the link for the membership, I've posted it on many of our videos. So just look on the comment section on the other videos, not on this one because I haven't edited yet. Once I edit it, I will put it on the comment section. But just find it. It's very easy to access, and you will be you will be learning quite a lot within our membership. All right. So enough with the membership. I just wanted to talk a little bit about that. Another question that I got last week from one of the nurses was like, what should I do 1 week prior to my exam, or until what date I should be like studying full to then take the NCLEX? My answer to this is what we usually suggest for the nurse to study and practice questions every day, like I have mentioned on other videos. And the most important thing is, I think the day before your exam, you have to take a day off. Many nurses, they like to study all the way to the day of the exam. And I think that's a mistake because you need to give your brain, your mind, a little bit of a relax time before you take the NCLEX. And think about this: if you haven't learned what needs to be learned the day before the exam, you're not gonna learn it that last day. So take that last day before your exam to relax. If you live close to the beach, go to the beach, go to the pool or whatever. Go somewhere where you are relaxing, and that way you can go to the day of the test a little bit more calm. I think many of you are very prepared, but when you go to the NCLEX day, you're so psyched up, you're so worried, you're so exhausted mentally that you make a lot of mistakes the day of the exam. So that is what I teach my students. That is what I do. That's what I did, and it worked fine. So take the day prior to your NCLEX off, okay? And I'm parked now, so I can read some of the comments. Naomi, she says she passed the NCLEX thanks to our channel. Thank you, Naomi. It all, we get a small credit, but the big credit is for you guys, okay? Because it takes a lot of dedication to really pass the NCLEX and fulfill your dream. So let me see. Another question that I get is, how did I prepare for the NCLEX? Okay, now know that I took the NCLEX 6 years ago. Okay, but the NCLEX hasn't changed much since I took the NCLEX. I took the NCLEX. I studied for about a month and a half. I didn't have a lot of whole time to study because I had a family to support. We were struggling financially big time, and I just couldn't spend a whole lot of time studying full time. So I did the next best thing. So I studied for about a month and a half, and I was studying full time, meaning from 8 a.m. to 6 p.m. I was studying every single day, Monday to Friday. Now, I know that not all of you can do this. I know that many of you have kids, have other responsibilities, you have a work, you might not be able to do it. But you should be studying, if you're full time, 6 to 8 hours minimum. Okay? 6 to 8 hours minimum on NCLEX preparation, regardless of if you're studying full time or you're studying or preparing for the NCLEX part time. You need to answer questions every single day. And I've talked about this multiple times. The quality of questions that you're doing is very important. Okay, and I've have mm, suggested here in our YouTube channel, Kaplan. Kaplan is a very good resource. UWorld is a very good resource. Definitely the Saunders book or Pearson's book. I talked about this on last week's live. Make sure you're watching it if you haven't seen it, because I talked a little bit about that. But you have to be doing anywhere from 50 to 75 questions every day. This is important. Okay. So any other questions that you would like me to answer? I'm here looking at some of the comments. I'll try to see if I pick up a question here that you wrote. All right. Let me see. And if you have any questions, please go ahead and post it here in the comment, and I'll try to answer some of those questions now or on the next live. I'll try to answer them. Brenda, how do I become a member? Brenda, it's very simple. If you looked at any of our other videos in our YouTube channel, you will be able to see on the description section the link for our membership. Just click on that link and you will be able to join. Brenda is from South Africa. Wow. Thank you, Chantal. Natasha passed the NCLEX. Congratulations, Natasha. I see Kirandi asked a question about the NCLEX, if it was going to be harder. I talked about that. All right. Let me see. Okay, so I'm about done. So if you have any other questions, please comment in the comment section so I can take the time to answer to you. I think this live are beneficial exactly for that reason. I know it's many of the YouTube channels you cannot really interact with the professor, so this is a good opportunity for you to ask me questions, and I'll try to do the best I can to answer them. Cynthia, hi professor. I just started watching the videos on how to pass the NCLEX. Yes, Cynthia. So I don't know which order you're doing it, but make sure you're watching the ones that is in red, the ones that says how to pass the NCLEX step by step. Watch that one first. That was my first 7 day training. Then watch the pharmacology one that is in blue. The pharmacology 7 day training was very, very beneficial. Okay. Is board vitals good for NCLEX preparation? Josephine, not too familiar with board vital. Not haven't heard of them. Chinelo, is 1 month enough to study and pass the NCLEX? Oof, Chinelo, that's a hard question. It depends on the student. What I have seen in 5 years mentoring thousands of students, the average is 3 to 6 months, 3 months to 6 months average. But most of our nurses, they're not English speaking nurses, so they have issues with the communication, so they have to learn that as well. But if English is not the problem, 1 to 3 months is okay. Like I have seen a lot of the nurses in our YouTube channel, many of them a month and a half is enough for them to pass. But my actual experience has been 3 to 6, 3 to 6 months. Mukta, I did my graduation in 2012. There's a big study gap. I want to know if I have. Let's see. Want to know if I need to start Sanders or Archer or UWorld. If you've been that long without studying, I suggest you start reading the Sounders at your own pace. Try to catch up a little bit on the reading, and then Archer is a very good Q bank. Not a lot of prioritization questions there, but good content questions. So to practice content, I think it's good, and the price is pretty decent in comparison to other providers. Jose Mijares, let me see, Professor, I have the membership and I will take the NCLEX December 5th. Any advice? Jose, just watch those videos left to right, right to left, over and over. Also, there is a call the number to our Spanish Academy. Okay, give our advisor Lisbeth a call because we have all the things that you could use in the Spanish Academy. I see you have a Spanish first and last name. This is the only reason why I'm mentioning this. And also, if your comprehension in Spanish is good, go to the NCLEX Crusade YouTube, not the international, because this is NCLEX Crusade International. This is the English version. But there's a Spanish version for Latino nurses. Maybe you find some quality videos there that could help you. So give that a shot. I'm assuming that you speak Spanish. If not, then our YouTube channel and the membership is good. Let me see. Is it still possible to sign up for the membership? Yes, anybody can sign up. Marie, since the NCLEX is changing, is the Sounders book changing too? Yes, but not a lot of changes actually. The Sounders has a new edition, the ninth edition, that includes the next generation tips, next generation NCLEX. So, but not big difference actually. They're maintaining most of the old stuff, but if you want to know the new next generation questions and the like how to study and prepare, maybe by the ninth edition, it will be better. Oh, okay. You were in the Miami event. Oh, yeah. So there's definitely a lot of things you could use to for your preparation. When everything is confused in your head, what can I do? When you say confused in your head, does it mean that you have a lot of information, like content information? If that's what you're saying, I think this is a very common experience among all of the nurses that prepare for the NCLEX because there's so much information that you feel clustered. You feel like you have so many things you have to learn. What I do, I try to focus more on practicing questions. That kind of helps me wind down a little bit and focus. So try that. It worked for me. I try to practice more questions, focus more on practicing questions than trying to learn and memorize all the content. Okay. When I start the membership, where should I start? Joanna, I will start with the prioritization strategy videos. That's that will be the first step. How do I transition to the US as a psychiatric nurse? I don't know a lot of the technical or documentation process, unfortunately. So I cannot answer that question, Modupe. Not too familiar with it. Cynthia, I checked the link regarding your membership. I'm not too clear of what it offers. Cynthia, the membership is very basic. Basically, all it is, you will have access to videos that I have in the membership from live classes that I've done in the past. So every time I do a live class, I record it and I upload it into the membership. When I do those live classes, I usually charge about $25, $50 per class, depending on which class I'm doing. The benefit of the membership is that anytime I do a live class, I upload the recording version to the membership. So technically, you're having access to what were live classes inside the membership for the $9.99 option. So that is what you're receiving, but it doesn't include any of the live classes. There is not thousands of videos there either. There's right now close to 50 videos, but what you will see there's nowhere else to see those kind of videos in the YouTube community or anywhere, because we teach very specifically, and it's a little bit of what I've done on the 7 day training, but more in depth, because I have 3 hours to explain questions, 3 hours to explain specific strategy, like for example the prioritization videos. We're talking about 2 hours teaching the same strategy, so it helps retaining more the information. Is the membership for free? No, it's not for free. I have done like raffles in the past. Right, I think we have given so far like 60 or 70 free access to our membership. I do it every so often to help the community out there. But no, it's not free. The charge is, if you right now if you subscribe, there's the option for access to 3 months for $9.99 each month. I think it's like $27 or something like that. At least for the U.S., it's very inexpensive. All right, almost finishing up here, guys. Just want to see if there's any other question. Uh, when is the latest video available in the membership? The last class that we did was basic care and comfort. We did it Friday. I still gotta do some editing to that video, and I should upload it into the membership maybe today or tomorrow, the latest. Okay. All right, guys. Well, 32 minutes. I gotta go. I hope you have found this live that I have been doing at least once a week, just chatting, communicating with you guys. I know it's not something too overly um, professional, but I think it's good for us. That way we can know each other. You can know me as a professor that is here to help you, and at least answer some questions that the community has. And I hope you find our YouTube channel a blessing, that you find our academy a blessing, and I'll do the best I can to continue providing quality information, valuable information, and resources for your NCLEX preparation. Don't give up. Keep fighting for that dream. God bless you all. Bye bye.